Sup, my chooms and choombadas? Hope everything is Nova and you're all having a preem week. So I gotta tell you, when it comes to hair loss, one subject that has always been interesting to me has been the subject of women's hair loss. If you are a woman and you are losing your hair, chances are you don't feel there are as many resources out there to tackle the problem simply due to the fact that not as many women go bald compared to men. Going bald though, it sucks whether you're a man or a woman. But when you're a man, at least people will think things like, oh yeah, a man losing his hair, that's perfectly normal. In the case of women though, hair loss isn't quite as ubiquitous, and this leads many women to think that their hair loss is likely caused by some sort of health problem or disease, and other women around them will think the same thing as well, and that can be very stigmatizing. The truth is though, that hair loss in women, even though it isn't as common as it is in men, is still fairly common. In fact, 40% of all women will experience some degree of female pattern baldness by the age of 50, and like with men, the most common cause of hair loss in women is androgenic alopecia, which is due to a genetic sensitivity of hair follicles to androgens. Women don't have as many androgens as men, but they do produce some, and for some women that is enough to cause hair loss. Oftentimes, women are given the impression that they don't have as many treatment options as men. They're told that they can never use finasteride under any circumstances because of the risk of birth defects, or they're told that the only viable treatment that is available to them is Minoxidil. Also, many of the scam gimmicks that we see that are promoted towards men, like low-level laser light therapy, scalp massages, as well as all the other countless herbs and essential oils out there that don't work, are also marketed towards women, sometimes even more so. Also, like with men, it is possible women come from communities that will not be supportive of their struggle against hair loss. Like with men, many times they'll be told that there's nothing they can do about it, and their friends and family members will tell them things like, "Just shave it, babe! You'll look like Natalie Portman from V for Vendetta, or Sigourney Weaver from Alien 3, or maybe you'll even look like Persis Kambata from Star Trek the Motion Picture." The truth is that it's not a good idea to get an opinion about hair loss from a loved one, because they'll give you a biased answer since they don't want to hurt you emotionally. I remember when I was losing my hair, all of my friends and loved ones would either tell me that they didn't notice my hair loss, or that hair loss is no big deal, and it caused me to just blow it off for a while until I lost my hairline, and I absolutely hated it. Don't let it come to that. Take action before it is too late and get on treatment. So, what is it you can do if you are a woman who is losing your hair? Well, as it turns out, women, contrary to popular belief, have plenty of options. In fact, they have even more options than men. So not to worry, lasses, I am here to find out what those solutions are and break it down for you one point at a time and explain why women losing their hair don't have to accept their fate of becoming female slapheads. So, when you read about androgenic alopecia in women, it is often referred to as female pattern hair loss. So what is female pattern hair loss, and how is it different from male pattern hair loss? Well, there are more similarities than differences between the two, and the ultimate causation for both of them are the same. They're both androgenic, meaning that the hairs involved have a genetic sensitivity to the trash hormone DHT, dihydrotestosterone. So even though it is present in much lower amounts, females do have testosterone, and some of that testosterone can convert into dihydrotestosterone, DHT, via the 5A reductase enzyme, which is on our scalps. In women, testosterone is produced in the ovaries, the adrenal glands, and in the peripheral tissues. So as you can see here, testosterone levels in women are normally much lower than in men, and so DHT levels are subsequently lower too. So what is the deal with women who are going bald? Is it because their testosterone levels and therefore DHT levels are too high? Well, there is some conflicting data on this. Some studies show no abnormalities in testosterone levels, and some other studies do. In a study of 210 patients with female pattern hair loss from 2016, no abnormalities of androgen levels were found. On the other hand, a study from 2019 showed elevated testosterone in 6.6% of women with female pattern hair loss. But you could see that some other endocrine abnormalities, such as abnormalities of the thyroid-stimulating hormone, luteinizing hormone, and follicle-stimulating hormone were also present. However, the best way to look at this data is that the majority of women with female pattern hair loss do not have endocrine abnormalities and do not have elevated testosterone levels, and this is pretty consistent amongst all studies of women with female pattern hair loss. So the bottom line is, most women who are losing their hair are still perfectly healthy women with normal normal endocrine systems. They just were dealt the same short end of the stick when it comes to the genetics that men were when it comes to pattern hair loss. So one thing that confuses a lot of people about female pattern baldness, though, is how is it possible that women with normal androgen levels can possibly still lose their hair? Finasteride, for instance, lowers men's DHT levels by about 60% and will solve hair loss in virtually all men who take it. Yet even with finasteride, a man's DHT levels will still be much higher than those of a woman's. How is it that this is something any woman should have to worry about, considering how much lower their androgen levels are? Well, it is a bit of a mystery. It isn't something researchers have fully figured out yet. In fact, there are a lot fewer studies on androgenic alopecia in women than in men overall, and this is probably because it is less frequently occurring in women than in men, or maybe there's a gender bias in the people doing these studies, that they are somehow more interested in men's hair loss than in women's. I mean, who knows? Also, in some cases, there may be factors involved that are not related to androgens at all. There was a frequently cited case report published in 2010, in fact, that described a woman with female pattern hair loss who had what's called complete androgen insensitivity syndrome, which is a mutation of the androgen receptor gene that causes complete loss of response to androgens, yet this woman developed the typical female pattern hair loss pattern. So here's her picture. However, this is just one case report, and to counter this case report, there is strong genetic data that female pattern hair loss is related to male pattern hair loss. Female pattern hair loss is more common in families that carry the genes for male pattern hair loss, in fact. In a study of 210 women with female pattern hair loss, 85% of patients with female pattern hair loss had a family history of androgenic alopecia. Also, scalp biopsies of women with female pattern hair loss show the exact same miniaturization of hair follicles and the same pathology that men with androgenic alopecia have. So maybe most women with female pattern hair loss are, for some reason, exquisitely sensitive to even trace amounts of DHT in their hair follicles, but the exact reason women get female pattern hair loss, even with low levels of androgens, is something that is not really known yet at this time. Female pattern hair loss is also distinct in that the pattern is usually different from the pattern seen in men's hair loss. Men have the Norwood scale to assess severity of hair loss, which you can see here, and as you can see with men, hair loss typically begins at the temples and proceeds to the vertex, and gradually it all merges together to give men the left swipe slaphead look. In women, the main scale used is typically the Ludwig scale, where you see the hair loss begin at the central hair part and progress outwards until there is balding at the top of the head. The temples are usually more spared than in men who have androgenic alopecia. Here's an example of a real patient who has female pattern hair loss, where you can see the Ludwig scale in full effect. Why this pattern happens more frequently in women compared to the temple and crown recession we see in men isn't known. However, the fact that the patterns of hair loss are different in men and women typically is another strike against the Blutflu theory, because if the pattern was due to scalp tension, as a lot of hairline fraud cells like to claim, then you would expect the pattern of hair loss to be the same across genders, because why would scalp tension and Blutflu be different between the genders? Anyways, that's besides the point, and I'm kind of beating a dead horse here with this debunked Gallia aponeurotica theory, so let's get back on track here. DHT, dihydrotestosterone, is the main culprit in the progression of androgenic alopecia, whether it be in men or women, and therefore treating female pattern baldness is contingent on handling the presence of DHT on the scalp. Even though I mentioned that case study earlier where a woman had female pattern hair loss despite total resistance to androgens, it is important to mention that that was just one case study and hardly the norm. Drugs that lower androgens on the scalp of women will work to stop hair loss just as they do in men, even if all the nuances behind female pattern hair loss haven't yet been discovered. So most people know, and most doctors will tell you, that the main treatment option for fighting androgenic alopecia in men is finasteride, which is typically prescribed at 1 milligram per day or less based on how the patient responds to treatment. This drug works because it blocks the 5A reductase enzyme on the scalp, which converts testosterone into the trash hormone DHT, which of course is the androgen which causes hair loss in both men and women. So since DHT also causes hair loss in women, finasteride will also work for them. However, women do require higher doses of finasteride. Specifically, they need 5 milligrams daily in order for it to be effective, as research has shown that lower doses, like 1 milligram per day, that are effective in men are just not as effective in women. Now, I made a video specifically on finasteride use in women, and I'll link that below if you want more information about finasteride use in women. But one thing I think I do have to emphasize is that finasteride is not appropriate for premenopausal women who are pregnant or trying to conceive, as the 5A reductase enzyme and DHT is important for fetal development, particularly for male fetuses. Therefore, pregnant women or women who are trying to become pregnant should not take or even handle finasteride. However, I gotta say, I don't ascribe to the notion that women should never use finasteride. A lot of people say this, but I think it's actually kind of sexist, as it assumes women don't have control over their fertility. We are not living in the dark ages. If a sexually active woman doesn't want to get pregnant, there are plenty of ways to ensure that this doesn't happen. So it is very easy for a woman to use finasteride and also make sure she doesn't get pregnant, and we shouldn't patronize women by saying that just because you're capable of having children, you shouldn't take finasteride under any circumstances. It's a woman's choice whether or not to get pregnant, and it should be her choice whether or not to save her hair using finasteride. Finasteride is a very well tolerated drug, which already has a low incidence of side effects in men, and that side effect profile is likely even lower in women, since one of the side effects that men can rarely get is erectile dysfunction, and that's obviously not something that women need to worry about. But what if you are a woman and you only want to use treatments for hair loss that are FDA approved for women? Well, I've got some good news and I've got some bad news. The bad news is that there is only one treatment for women that is FDA approved. The good news is that it's a very good treatment, and that treatment is Minoxidil, which is now approved at both 2% and 5% for women. It used to be only the 2% variation was approved, but now 5% for once daily use is FDA approved for the use in women. Minoxidil is also FDA approved for men, but it isn't typically seen as a very good standalone treatment, as it doesn't go after the root cause of hair loss, which is the presence of DHT on the scalp. There are many theories as to how minoxidil works. We know it is a growth stimulant that promotes the growth of the dermal papilla cells, which are the hairs DHT is trying to destroy, but officially the mechanism of action behind minoxidil is unknown. So using minoxidil alone as a man may buy you some time, but eventually a man will have to do something about the androgens on his scalp, or else minoxidil will simply lose its efficacy after a couple of years or so. It's possible minoxidil may serve as a better long-term standalone treatment for women, since they don't have as many androgens on their scalps, but generally speaking, if a woman wants to play it safe, they should be using something to also control the androgens on their scalp, in addition to using a growth stimulant like minoxidil. So when it comes to men at least, there really isn't much out there better than finasteride. We also have Dutasteride, which works similarly to finasteride and suppresses more DHT than finasteride, but we don't have much data compared to finasteride on its long-term safety and efficacy, as its follow-up research data is limited to just 6 months. In the case of finasteride, we have data proving it maintains its safety and efficacy even after at least 10 years of usage, and I have a video about that which I'll go ahead and link below. Also, for men, we have some other options such as topical anti-androgens like we have Floridil and clascoterone, but the therapeutic options for men are limited due to the simple fact that men cannot use oral anti-androgens without compromising our virility. Fortunately for women though, this is obviously not a problem. It turns out one of the drugs most prescribed off-label for female pattern hair loss is Spironolactone, also known as aldactone. This is actually a diuretic medication, and diuretics usually lower potassium levels. In the case of spironolactone, though, it actually raises potassium levels. Because of this feature, it is often combined with other potassium-wasting diuretics to preserve potassium levels in its users. Spironolactone is often used to treat high blood pressure and heart failure. The drug doesn't have much, if any, anti-androgenic activity at lower doses when it is prescribed as a diuretic, typically at 25 milligrams daily. So, to get utility out of it as an anti-androgen, it needs to be prescribed at much higher doses, usually around 100 or 200 milligrams daily, or even more than that. At these high doses, it is a moderately effective androgen receptor blocker, and it also inhibits testosterone production in the gonads and adrenal glands, which will therefore lower DHT levels. However, men cannot use it at these high doses because its anti-androgenic effects would cause feminization, and in fact, spironolactone is often often prescribed to male to female trans women, especially since it is not as liver toxic compared to other anti-androgens like flutamide or cyproterone, making it better for long-term usage. Fortunately, spironolactone's benefit at stopping hair loss are not just conjecture. There are several small trials of spironolactone for the use of female pattern hair loss. One of the first studies was from 2005, and it is titled, quote, "Treatment of female pattern hair loss with oral anti-androgens," unquote. This study looked at 80 women aged 12 to 79 years with female pattern hair loss, so that's about as diverse of an age range as you can get. The researchers used scalp biopsies to confirm hair follicle miniaturization, so these women all had a firm diagnosis of female pattern hair loss due to androgenic alopecia, which is alarming because it shows even girls as young as 12 years of age can have signs of it, which is pretty damn depressing. The women had scalp photographs done at baseline and after 12 months of therapy. The therapy consisted of spironolactone prescribed at 200 milligrams per day, and the comparison therapy was cyproterone prescribed at 50 or 100 milligrams for 10 days per month, with the dose dependent on whether or not the women were premenopausal. Cyproterone, like spironolactone, is an androgen receptor blocker with a progesterone-like effect as well, and progesterone itself is an anti-androgen because it competes with androgens for androgen receptors. In fact, oral contraceptives that contain synthetic estrogen and progesterone derivatives have also been looked at for treating female pattern hair loss, and we'll look at them in a moment. But getting back to the study, half of the women in the study were given spironolactone and half were given cyproterone, and like I said, they were evaluated with scalp photography after 12 months of therapy. The before and after photographs were assessed by 3 physicians who were blinded as to which group each patient was in. Also, patients had blood tests done, including serum testosterone and DHT levels. So getting to the results of the study, only 4 women out of 80 had elevated free serum testosterone, so the vast majority of these women had normal androgen levels, which is consistent with the studies I showed you before that showed that androgen levels are usually normal in women with female pattern hair loss. Getting to the photographic results though, the 2 treatments were equally efficacious. Here are examples of the response to each drug. Overall, 88% of women showed improvement or no further hair loss on spironolactone or cyproterone. So even though this looks good, the study is limited in that it is just a before and after study and there is no control group. But being that we both know that these drugs are anti-androgens, it certainly is not surprising that they would work against androgenic alopecia in women. However, the lack of controlled double-blinded studies of spironolactone for female pattern hair loss is probably why the drug is not approved for this particular indication. Nevertheless, it is studies like this one and other similar studies that have led to spironolactone being often prescribed off-label for the treatment of female pattern hair loss. So one study that I feel I need to go over, because I'm sure someone will bring it up, is a study that looked at the combination of spironolactone and oral minoxidil, which you guys all know I am a huge fan of. This is a study by Dr. Sinclair, who has the Sinclair Female Pattern Hair Loss Scale named after him, which is similar to the Ludwig scale, though not as well known as the Ludwig scale. Anyways, the article is titled, quote, "Female Pattern Hair Loss, a pilot study investigating combination therapy with low-dose oral minoxidil and spironolactone." In the study, Dr. Sinclair looked at the combination of spironolactone at 25 milligrams daily and oral minoxidil at 0.25 milligrams daily. Both of these are very low doses, but that's probably because both of these drugs lower the blood pressure of the person using it, and higher doses would not be tolerated. In fact, the drugs were given along with salt tablets in some women who had low blood pressure to begin with, just to avoid bottoming out their blood pressure with these drugs. So they treated 100 women aged 18 to 80 years old who had female pattern hair loss. The results were evaluated using, you guessed it, the Sinclair scale for female pattern hair loss. This was not a blinded or controlled study in any way, so the methodology was pretty weak, but let's see what they found out anyways. Well, the average Sinclair scale went from 2.79 before treatment to 1.3 at 12 months. So definite improvement, though the Sinclair scale, like all scales, is pretty subjective, and we don't have more objective data like a phototrichogram that can measure exact hair counts or even photographic data. Also, since this is a combination of drugs, and we know that minoxidil does in fact work even in its oral form, it is hard to know how much of these results, if any, were due to the low-dose spironolactone as opposed to just the oral minoxidil. What we can get from this study, though, is that there are significant side effects from using these drugs together, even though Dr. Sinclair minimizes them in his discussion. Specifically, 8 women had side effects including rash, postural hypotension, which means a sudden drop in blood pressure when standing up that could cause loss of consciousness, and also 4 women had hypertrichosis, which means unwanted facial hair. The last side effect is not much of a problem in men, but for women, growing beards hasn't yet become fashionable. Also, the average blood pressure dropped 5 to 6 points, and 2 patients developed enough postural hypotension that they had to take salt tablets daily just to avoid passing out. So even at this very tiny dose of oral minoxidil, 0.25 milligrams daily, there are people who are getting significant side effects from using them. And there are men who are using much higher doses than this, and they are putting their cardiovascular health at great risk. And I've made several videos as to why oral minoxidil is dangerous, and I'll link 2 of them below. But the bottom line is, please just stick with topical minoxidil and don't touch oral minoxidil. So, anyways, we've already gone over why finasteride cannot be used by women who are pregnant or wanting to get pregnant. So what about spironolactone? Is this safe for pregnant women or women trying to get pregnant? Well, sadly, the answer to that is no. The issue with finasteride affecting fetal development also applies to spironolactone because androgens are still needed for fetal development, even DHT. So you may be thinking, how about applying spironolactone topically? Is this safe and effective? And I imagine many men would also be curious of the same thing, since a topical anti-androgen with minimal systemic side effects would be extremely useful. Well, the good news is that it doesn't look like topical spironolactone has much systemic absorption. In a study from 1988, no changes in serum hormone levels were seen after 6 male volunteers had the stuff completely slathered over 55% of their body, and also no detectable metabolites of spironolactone were seen either in any of the patients. So it doesn't look like topical spironolactone is systemically absorbed, which of course is good if you want to maintain your virility. But does it work is the important question. Well, maybe. In a study just released this year, in fact, which is titled, quote, "A novel topical combination of minoxidil and spironolactone for androgenic alopecia, clinical, histopathological, and physiochemical study," unquote, 1% topical spironolactone gel was compared to 5% topical minoxidil twice a day in 60 patients with androgenic alopecia, including 39 males and 21 females aged 18 to 45 years. The patients were divided into 3 groups. The first group got topical minoxidil, and the second group got topical spironolactone, and the third got a combination of both treatments. Patients were followed monthly for a year, and they were assessed with photographs and also with scalp biopsies before and after the completion of the study. The results showed that topical minoxidil showed a clinical response in 90% of the patients, while topical spironolactone showed a response in 80% of the patients. However, using both of them together showed a response in all 100% of the patients. The scalp biopsy showed significant increases in androgen hair counts, meaning more hair in the androgen growth phase in all 3 of the groups. Also, telogen phase hair, meaning hair in the resting state, decreased in all 3 of the groups. And the number of vellus hairs, which is miniaturized hairs, decreased too in all 3 groups. This figure shows some good responders to therapy in each of the 3 groups. In the top row, you even see some temple regrowth, which is pretty rare and astonishing since this is a group 1 patient who was just on 5% minoxidil, and none of these patients were on finasteride. The middle row shows a typical female pattern hair loss with improvement on topical spironolactone, and the third row is a male on the combination of both therapies. These are pretty impressive results. Personally speaking, I have actually used topical spironolactone, and it was way back in either the late 2000s or early 2010s, back when I gave into the fear about finasteride and was looking for anything I possibly could to use as a substitute to counter the androgens on my scalp. The spironolactone that I used was from Dr. Lee's website, which was shut down about 10 years ago or so, and I used it probably for a good 6 months, and I got to be honest, I don't think it did anything at all for me. I mean, maybe I was just a non-responder, but for me personally, spironolactone doesn't even begin to tread water next to something like finasteride in terms of effectiveness, so I probably would never use it again. But anyways, I have to admit this study does look promising on the surface at least, choice, but it does need to be verified with further research before it can be compared to something like finasteride. I'd also probably like a little more assurance that it doesn't absorb systemically beyond just the 1988 study that I cited before, which was just in 6 male volunteers, and that it's somehow safe without the risk of any kind of hypogonadal side effects. I think the sample size was way too small in that study. But anyways, earlier we mentioned that progesterone is an anti-androgen, so getting back to women with androgenic alopecia, what about using birth control pills that contain synthetic varieties of estrogen and progesterone, which are both hormones that are theoretically good at treating androgenic alopecia? Now, this obviously is an option for men, but do they work for women? Well, in a review article from 2017, which I'll link below, several studies support the use of oral contraceptives for treating female pattern hair loss. Now, there are a lot of different types of birth control. Some contain estrogens and some only contain progestogens, but certain formulations seem to be helpful for treating acne and female pattern hair loss, and paradoxically can also treat hirsutism in some women, which means excessive hair growth, usually in regions of the body that are not desirable for women, like the face. Now, I linked a study on contraceptives with anti-androgenic progestogens below. However, there are also some formulations that are pro-androgenic and might make things worse. So make sure you check with your doctor to make sure you are using an oral contraceptive that is appropriate if you are suffering from female pattern hair loss. Birth control pills may be helpful, at least in theory, though there are not many, if any, high-quality studies supporting their use for anything besides preventing new humans from being conceived. So to summarize a lot of the data that we covered, you should take away the point that treatments for women's hair loss and men's hair loss should be seen as mostly the same. The treatments for androgenic alopecia that work in men will also work in women, though sometimes with some modifications needed, like the need for higher doses of finasteride in women than in men. However, there are some female-specific hair loss treatments that I covered, like spironolactone and oral contraceptives, that aren't really practical or safe for men. But other than that, treating women's hair loss should not be seen as being any different than treating men's hair loss. Therefore, even though this is a video specifically about androgenic hair loss in women, all of my other content should still provide some valuable insight for you on your hair loss journey, and I hope you find some valuable information on my channel, both now and in the future. So until then, I'll see y'all next time. Take care.